prescribing a medication, you have to know your patient, and you have to know whether or not they're in an at-risk group. One of the most common places where stimulant medications are being diverted is in college campuses right now. And that's because college students are using them as cognitive performance enhancers, help them stay up late and study. There's also use of stimulants on campuses to enhance partying, to stay up all night, to counteract the effects of alcohol, for example. So the medications that are least likely to be abused are non-stimulant medications. I'm talking about 3 FDA-approved treatments, including atomoxetine, guanfacine, and clonidine. Now, there are other stimulant preparations that are less likely to be abused. For example, orosmetylphenidate or lisdexamphetamine. These are very slow-releasing medications that cannot be crushed and snorted or intravenously administered. So there's really no abuse potential with these medications. On the other hand, they can be used to stay up late or to party late into the night, and therefore you do have to consider, if that's a concern, whether these long-acting preparations of the stimulants are appropriate. Some physicians are worried about the medical legal consequences that might incur if their patient is misusing, is caught, say, diverting a stimulant medication or abusing it. Some patients may require, additionally, a contract be signed, and more physicians are now using contracts with the patient signing off saying, I understand that this medication is being prescribed for me and me only, and that I will not share it with anyone, nor will I misuse it. These kinds of devices also ensure that if you document it carefully, that anything that happens down the road isn't really your fault, and therefore you won't be held medically or legally accountable. Now, we'll go over this in greater detail in one of our upcoming seminars.